In 1947, Monsignor Luis del Rosario, S.J., Bishop of the Diocese of Zamboanga, of which the Church of Davao belongs, requested the establishment of a Catholic hospital in the city of Davao. He directed this request to the PME Fathers in Canada through Monsignor Edgar La Rochelle. On May 15, 1948, the 5 missionary nuns who were chosen for the missionary work to Mindanao were Sister Pauline Gilmet, Sister Rita Blay, Sister Cecile Denis, Sister Therese No, and Sister Therese Corriveau. They took the train that brought them to Montreal, then to Chicago, and finally to San Francisco, where they took a boat, the SS General Gordon, to cross the Pacific Ocean. On June 8, 1948, they finally reached the main port of Manila. One day after arriving in Manila, they took a plane going to Davao City. It took them almost 6 hours, with several stops along the way, to arrive in Davao. Having been an open city during the war, big buildings were scarce. San Pedro Church, the priest's convent, plus few houses were the only ones left standing. When the Japanese left, the people returned to their homes. Davao was then dominated by the Bagobo tribes. Initially, the nuns stayed with the RVM sisters at the Immaculate Conception College, which had a new building at the back of San Pedro Church Rectory. After a week, they transferred to the second floor of a house in Claveria Street. The first floor was being used by the Bank of the Philippine Islands. On October 1, 1948, the Hospital de San Pedro was blessed on the feast of Saint Therese of the Infant Jesus. The small hospital was purchased from Dr. Alfredo Rivera. It was a 13-bed capacity hospital located at San Pedro Street, corner Legazpi Street. Dr. Alfredo Rivera continued to be the medical director of the hospital with the help of Dr. Bienvenido Escoto. In 1949, the sisters saw the need to put up a new building with more facilities in order to meet the needs of the time. A piece of land was purchased at Santa Ana Street. It was named San Pedro Hospital. Why San Pedro? Since it was located at Santa Ana District, everyone expected that it would be named Santa Ana Hospital. But such was not the case. The sisters took into account the great devotion and faith of the people in this fisher of men, and in reverence of the first venue of their apostolate in the Philippines, the hospital was named after Saint Peter, first Pope and fisher of men. Thus, it is now known as the San Pedro Hospital. The hospital had 50 beds. The second floor had 10 private rooms and semi-private rooms, 2 wards for male and female patients, and 2 wards for children. On the ground floor were the operating rooms, delivery rooms, laboratory, X-ray, pharmacy, outpatients, doctors' offices, and the offices of the administrative staff. In 1955, Dr. Panuncialman took over as medical director. In 1964, Mother Marie de St. Paul pursued her dreams of constructing a 4-story, 350-bed hospital that will serve the fast-growing city of Davao. Groundbreaking was on a warm feast day of St. Joseph, March 19, 1965. And construction began in May 1965. Finally, on February 11, 1969, the feast day of Our Lady of Lourdes, the new and modern San Pedro Hospital was inaugurated with then Apostolic Nuncio in the Philippines, His Excellency Archbishop Carmine Rocco, as guest honor. The hospital was equipped with the latest in modern facilities, with expanded space for doctors' offices and other hospital services. Among the early staff of the hospital were Dr. Jose Gantioki in radiology, Dr. Francisco Manzanares in surgery, Dr. Manalo Ongchanco in laboratory and pathology, Dr. Pelagio Iriarte Jr. in pediatrics, Dr. Manuel Villanueva in anesthesia, to name a few. In 1972, the labor union was formed in the hospital. There was hesitancy to recognize the formation of the labor union due to the nature of its services. They started to picket, but it was aborted due to the proclamation of the martial law by President Ferdinand Marcos. In 1973, Sister Florida T. Manzano, OP, was appointed as the new administrator of the hospital. She followed Sister Bonifacia Texon, OP, who succeeded Mother Marie de St. Paul, OP, who retired in 1972 after 25 years of service. In the spirit of solidarity with the poor, the new Board of Management accepted the labor union. On November 14, 1974, the first Collective Bargaining Agreement, or CBA, was signed. In order to solve the problem of understaffed medical services, a residency and internship training in medicine was established in 1975. This necessitated the strict departmentalization as required by the training programs and requirement of subspecializations in all services. In 1977, San Pedro Hospital became a member of the consortium in the establishment of the Davao Medical School Foundation. It was also during this time that the fourth floor was opened to accommodate more patients. It was inaugurated by then Bishop of Davao, Monsignor Antonio Mabutas, assisted by Sister Manzano. The 1980s were difficult years for the hospital. There was turmoil all over the country. President Marcos was removed from office through people power. The new President Cory Aquino hurdled several coups d'etat. The whole country faced an enormous uncertainty. The hospital also faced an economic crisis due to the decrease in hospital income. This was brought about by less number of patients admitted. The fourth floor was forced to close, and the hospital needed to reduce the number of personnel. Most of those affected understood and readily signed their consent for retrenchment. However, a minority, mostly rank and file, refused and demanded that they be retained. They demonstrated in front of the hospital. This was a traumatic experience for the Dominican sisters. Despite the negative events that haunted the hospital, true to the goals of the Dominican spirit, the hospital conducted several medical missions to many barangays, especially the marginalized sector of the society. 1995 paved the way for Sister Florida Manzano, OP, to become the hospital administrator again. In 1998, in time for the celebration of its 50th foundation anniversary, San Pedro Hospital built another alternative multi-purpose building that will house more doctor's clinic, a pharmacy, interns, and residence quarters, an audiometer, and an alternative medicines clinic. New changes in the hospital's landscape were evident. After 60 years in service to the people of Davao and even the neighboring cities, San Pedro Hospital has transformed into what it is now. One of the biggest, most well-equipped tertiary hospital in the region. From a humble 13-bed capacity in 1948, San Pedro Hospital treaded the turbulent tides of time and persevered. It is the fulfillment of what was once only a dream of a concerned bishop and 5 dedicated missionary nuns. From its humble beginnings, it has grown by leaps and bounds through these many years to become a leading multi-specialty healthcare facility with state-of-the-art medical, therapeutic, diagnostic, and intensive care facilities. It has a bed capacity of 300, a modern 20-bed ICU unit, radiology, sonology department, laboratory, endoscopy, and bronchoscopy, heart unit, rehabilitation center, all using cutting-edge medical technology. Still true to its goal, that is, to provide a high quality of medical and nursing care to all patients, to help patients accept suffering and death in a dignified and Christian manner, and to cooperate with the community in the promotion of health through formal and informal education. The hospital also serves as the laboratory for training of nursing, medical, pharmacy, medical technology, and social work students of several schools in the city. San Pedro Hospital continues to grow in all facets to be at the forefront of the healthcare industry, notwithstanding the fact that it is focused on giving the best service in patient care. It likewise strives to be a well-rounded institution with efforts in maintaining environment health and safety standards in compliance with government regulations, commitment to staff welfare and development, and innovation in all aspects of healthcare. Since then and onwards, in pursuit of professional excellence, San Pedro Hospital has been and will always be committed to improving the quality of care and service to the people with the highest ethical standards.